As you know, people who are here in the United States legally have never been eligible for the Obamacare subsidies, for Medicare, for Medicaid. So what exactly are you saying that they're trying to do when you talk about giving free health care to them?
I'm so glad you asked. Okay, so when we passed the One Big Beautiful Bill, the Working Families Tax Cut, we had Medicaid reforms in the bill. You and I talked about it on the air. What we did was to eliminate fraud, waste, and abuse. There were a lot of people on the program who were enrolled in the program who were never eligible to be there. Medicaid is intended for eligible U.S. citizens, not illegal aliens, not also U.S. citizens who are able-bodied workers like young men. So we passed the law. The president signed it into law. Democrats voted against it, of course, and it's been wildly successful.
What you did was narrow the eligibility for certain people to get access to the ACA subsidies. What they want to do is undo the changes that Republicans made in that. But basically, wouldn't that only affect people who do have legal status, people who are refugee seekers here in the United States, asylum seekers here?
Those are two totally different issues. Now, they've created this as a new argument that they have as to why they should not keep the government open, but they're arguing a December policy debate for a September funding issue. The subsidies that you're talking about don't expire until the end of December.
No. Those are the subsidies for just everyday Americans. That's one thing that obviously has been the main premise of their argument. But you're saying they want to give free health care to people who are in the United States illegally.
That is exactly what the effect will be.
But when I looked at it, there's a little nuance because they want to undo changes that y'all made, narrowing who is eligible to get that. Those are people who are refugee seekers, asylum seekers. They're not technically people who are here illegally, just cross the border.